Hello everyone, brings me great pleasure to introduce you today to Dr. Gaurav Medikere. He specializes in endoscopic skull base surgery and we are going to ask him questions to explain further. Doctor, what exactly is this endoscopic skull base surgery?
So endoscopic skull base surgery is a new dimension right now in ENT itself, where we use an endoscope, which is nothing but a telescope which we use through the nose, and we explore different parts of the skull base. So the skull base is nothing but the interface between the brain and the nose and the ear. So there are a couple of tumors which are quite common in these areas, and we, with the help of a nose as a portal, we can actually address these issues quite well.
Wonderful. So, doctor, then how is this endoscopic skull base surgery different from conventional surgery of the same kind? What are the advantages?
So the advantage of the endoscopic skull base surgery is because we are using the nose as a portal to enter the base of skull. We are not making any large cuts, or we're not causing any handicap to the patient. Earlier on, if these tumors had to be addressed, then they would do a craniotomy, which is basically opening up the skull and lift the brain and then address the tumor underneath it. But these days, because we don't need to do that, because we go through the nose, we can directly address the tumor without having to cause any associated comorbidity to the brain. So that actually takes down the hospitalization time drastically. And secondly, the advantage is that we get a close-up magnified view of the tumor and the surrounding structures, because we're very close to the tumor rather than using a microscope. So it gives us very good illumination. And the third thing is that because we have angled endoscopes or angled telescopes, we can actually look around corners pretty well. Whereas with the help of a microscope, we can only look in a straight line. So these are the couple of advantages that we can think of when it comes to endoscopic.
More precision and less damage.
Yes,
that's
exactly.
Wonderful.
Yeah.
So, doctor, given that this is such a precise surgery, is there a special training required for this kind of surgery?
Definitely. So before embarking onto endoscopic skull base surgery, you have to master sinus surgery first. So you have to be very well trained with the endoscope, and you should be able to manage handling two instruments at the same time, because when you're using the endoscope, you have to use another instrument inside the nose as well. So there's a problem with the amount of space that you have. So you're working in a very narrow tunnel. The second thing is you're not looking directly at the specific area of your surgery. You're looking on a monitor. So you need to have very good hand-eye coordination. So you're looking somewhere else and you're operating somewhere else. So that takes a very high level of training in order to do that, because you're working around very critical structures like the carotid artery, the optic nerve, you have the brain above. So the important thing to realize is that you should be able to perform endoscopic sinus surgery well in different scenarios and very complex cases. And secondly, you should be able to you should be confident enough to manage any kind of complications that could come out of the surgery.
Wow. So, doctor, what are the tumors and pathologies that this kind of endoscopic skull base surgery can be used for?
So there's a lot of pathologies that we can use this for. It's a quite a wide range of pathologies. But if we talk about tumors, so there's many tumors, like you have juvenile angiofibromas, you have optic nerve gliomas, you have pituitary tumors, you have frontal sinus osteomas, and many other skull-based tumors like clival chordoma, etc. These are the most common tumors that are actually associated with endoscopic skull base surgery. But having said that, any tumor which involves the skull base is an indication for endoscopic skull base surgery. There are many tumors which are inside the orbit or along the the extended sinuses as well. So with the endoscope, we can actually go all the way up to the parapharyngeal space now as well. So even these tumors can be tackled with the help of an endoscope. Other than tumors, there are certain other pathologies, like you have CSF leaks, you have optic nerve decompression after post-traumatic optic nerve compression, you have orbital decompression, many other issues which actually can be handled with the endoscope. I honestly think that endoscopic management is going to be, eventually it's going to be the future, because it's quite minimally invasive in these patients.
Right. Everyone looks for that. Thank you, doctor. The information has been the most insightful, and I'm sure it will really benefit our audience. In case you have any more questions or want to reach out to us, please reach out through the comment section. Thank you.